everyone, Nicole here. So today's topic is mental health and procrastination. And so I made some slides today because there's some important points I do not want to miss. So let's come along and talk about mental health and procrastination. Just gonna make myself little over here and over here. Here I am. Okay, great. So how bad can it be? A mental health discussion. So if you're in our Facebook group, you will see that like a lot of people are struggling with depression, anxiety. Some people have ADHD. Some people are hit points where they feel like it's like rock bottom, maybe dropping out, feeling horrible. And so I feel like I want to just say that we are like a super supportive group, but also I want to make sure that we know what to do when we feel that way. So this is my disclaimer, and I have a version of this in the rules for getting in the Facebook group too, but I know people kind of skim the rules for everything, click agree, done. But anyways, so in my role at Conquering Procrastination, I am not acting as a therapist. So in my regular life in BC, Canada, I am a registered clinical counselor. The thing is, I have to be really careful because that registration does not extend outside of BC at all. So the thing is, I am a therapist, but I'm not a therapist outside of BC and definitely not worldwide. So I need to just reiterate that I'm not acting as a therapist in this group. I'm also not diagnosing anyone. So even in my regular practice, I don't diagnose. I refer on to psychiatrists or psychologists because I'm a master's level counselor, not someone who has experience diagnosing with a DSM-4. So the third point here, our Facebook group, my coaching, and my courses, all under Conquering Procrastination, are not substitutes for a qualified local therapist. I think it's super important that if someone is struggling a lot and they feel like they may have anxiety, depression, or anything else that could benefit from help, that they reach out and get that help. So I'm going to talk to you about how to do that eventually too in this little talk. So I want to review the cycle of procrastination because for those of you who've been over this before with me, you'll remember that there's like so many things going on here that kind of just mimic or like really overlap so much with other mental health issues. So let's look at this. So here we have the situation. So the situation is outside of us. So we have, maybe how many classes we're taking, what kind of professor we have, what kind of summer we had, whatever we're bringing in. Like maybe we have a roommate that's annoying. Situation is everything going on outside of us. So our thoughts are, and keep in mind there's no start or stop, but let's start at the thoughts because it's at the top. So when we procrastinate, some of the thoughts we might have might be something like, I don't feel like doing this, or I can't do this, or I will do this later. So we have our thoughts, what we're saying to ourselves. And so you'll see like, as I go through some of the disorders in a minute, how much this just overlaps. And then we have our emotions, which you can't really see, but take my word for it, that's an N under there, emotions. So that go with procrastination often are just like stressed, overwhelmed, hopeless. So those are all very common feelings with procrastination and with anxiety and depression. So yeah, that makes sense that they overlap. Physically, when we are like looking at our homework and trying to make ourselves do it or not, or stressed out by it, we'll feel like the same symptoms as anxiety, like stress, panic, maybe tense. Physically, we'll be experiencing those types of things. Or we tend to be more hopeless and we might feel super tired or just like, I don't want to do this, like kind of down. And on the spectrum of that is depression, maybe like just feeling so hopeless. So watching out for those feelings and the behaviors that result from them. So in the procrastination cycle, the behavior is that we avoid the work. So you'll see some of these diagnoses involve avoidance too. Let's see, next one. So symptoms that look like procrastination. In depression, so keep in mind, there's a ton of different symptoms. These are just a couple I cherry picked out of there because they remind me of procrastination. So just because you meet these doesn't mean you have depression. You would have to go get a diagnosis that involved all kinds of other questions. But these ones remind me of procrastination. So diminished interest or pleasure in all or almost all activities most of the day. So a lot of people say, I just don't have motivation for my schoolwork. I'm not motivated. I don't want to do it. And so there's a spectrum to that where it's like, yeah, I don't want to do my homework, but I'd love to go out. And then there's, I don't want to do my homework or anything else in life. And that's like red flag, go get assessed for depression. The next one is the diminished ability to think or concentrate or indecisiveness. So you can imagine if it's hard to concentrate, it's hard to get organized and work. And if it's a big struggle to do that, then it's going to be really stressful to make yourself do that. It's a big, obvious one that could be involved in the cycle of procrastination. Anxiety, avoidance of stressful situations. As the cycle says, you're avoiding work, difficulty concentrating or focusing on things. So yeah, the anxious brain is in fight or flight mode, which is part of your brain. If this is your brain, your fight or flight mode thing is way under here. Your logical thinking mode is at the front here. It's hard to be logical when you're in fight or flight stress mode, which is anxiety, basically. So feeling overwhelmed and avoiding things or situations because of it. So again, avoidance. ADHD. So yeah, lots of overlap here. Trouble focusing on a task, organization problems, poor time management, impulsive decision making. So I put this one in because if you imagine in the cycle of procrastination, some people may be like, I'm going to do it later as a decision. And then other people may just be like, what am I doing? I didn't realize I was just not doing it and I was supposed to. And where did the time go? Poor coping skills for stress is another one. So if the cycle involves stress, then people with ADHD may have more trouble getting out of that cycle because they don't have the coping skills to get unstuck from that cycle. So this is an interesting one. It's got a big overlap with procrastination. It's almost like in the description. So just because you fit these, I'm assuming most of us do, just because you fit these doesn't mean you have ADHD. It's more complicated than that. At the same time, a lot of us think of ADHD as picture like a hyper 5-year-old boy, of course, that can't sit still. And people are like, make him sit still. And other people are like, no, he should go play. Anyways, there's more to it than that. There's different types of ADHD. Adult ADHD and ADHD in women look different than that stereotype of ADHD. So it doesn't hurt to look into it more if you feel like it'd be helpful. Another big thing about ADHD that I want to throw in is that anxiety and ADHD can get mixed up, and often, as we saw, that like with anxiety, it's hard to focus. There you get the symptoms of ADHD. With ADHD, ADHD can create anxiety because it's really hard to do all the things we think we should be able to do, and then that's a big amount of stress and anxiety. So it's a messy one. So should you see someone? So obviously only you can answer if you should see your doctor or a counselor or a therapist, but I'm going to make these points. So it can be free. It can be totally free. Lots of universities and colleges have free therapy, some even have like doctors on campus. So we'll talk about how to find those things in a minute, but it can be free. You might also have insurance. That's the next point. So you might have insurance through your university. Some universities will make you pay a fee. You're paying into a health plan. Just like, oh, there goes $40. But no, you should look at the health plan, see what's covered. You're paying for it anyways. You might as well use it. And similarly, if you're young enough and your parents have insurance, you may still be on their insurance plan and they may have killer benefits. Maybe you could get massages even. Look into the insurance. So the next point I want to talk about is a label is just a label so we know what works. So a lot of times we are scared to go see someone. We don't want to be labeled, or like feeling like, if I get diagnosed with depression, then they're like, I'm depressed. Like it's now my identity, and it's like a big sign over my head, and it's something I have to carry with me forever. But no. Don't worry. Don't think of it like that. Psych students can back me up here. The DSM, which is the Manual of Diagnostic Disorders, is a tool. We can categorize people by different symptoms that they have in common. And the purpose of this isn't to label and like weigh anybody down with a label. It is to see what helps. So when we do research on treatment, we use these categories so that we can really tease out what exactly works for who. It's pretty awesome, actually, if you think about it. Like, remember how I talked about anxiety and ADHD being so like similar in terms of procrastination. So they can do studies where they look at ADHD and people who do not have anxiety but have ADHD, and see like what treatments works for them. They can try that same treatment on people who have anxiety and not ADHD. Anyways, I don't know if you get my point, but if you get the right label, you're like fast tracked to figuring out the evidence-based practice that could help. So that's good. And my next question is, why not? What do you have to lose? And next point, it could really help. So what if you go to the doctor and they say, yeah, that's looks like this is what helps, and you do it, and it's like your life's better, and like, isn't that worth a shot? So I encourage people to go talk about their mental health with their doctor. So yeah, what's the first step? So you can get on Google, look at your school resources. You can see a doctor. So just if you have a family doctor, when you go home on break, just make an appointment. Or if they're local, great. Go to a walk-in clinic. Just see someone, tell them about what's going on, and that you would like to look into it further if there's any mental health things going on. If you get someone who's discouraging or just like, oh yeah, well that's university, like if they brush you off because you're a student and it's stressful, go see someone else, because yeah, hopefully everybody will be cool, but if not, don't get discouraged. Just remember that there are always options. So I'm going to include some like national crisis line numbers. So when we feel hopeless or depressed or anxious, and we're also trying to do university, it can be really, really heavy. That amount of responsibility, plus really honest struggles getting stuff done. It can feel hopeless sometimes. And if we're ever feeling suicidal or really hopeless in any way, you really need to call 911 or call a crisis line. Reach out. Don't be alone. Don't let yourself go down that road, because there's always options. I don't care if you tried therapy once 10 years ago and it didn't work. That's your depression discouraging you from trying again. There's always options. So I'll include some resources. And I want to also add that if you're feeling stuck, like if you're like, I know I need to talk to a counselor, I know I need to look into therapy, but I'm too overwhelmed. Post in the Facebook group. Just say, hey, can someone help me find resources for small town Tennessee, wherever you're from. Sorry. But just, that's what we're here for. People, sometimes it's even more easy to help someone else than yourself. So one of us will help you. Okay. So I just want to clarify, because I'm saying, procrastination and mental health, what a big overlap. They're almost the same. I'm saying all this stuff. And then I'm saying, hey, I don't help with mental health. I help with procrastination. It can be confusing. So I want to be super clear here. I am a counselor in BC, Canada, and with my clients, I am there. I will do the procrastination stuff if that's their deal, but I will also take them into the hospital or to a doctor if they need it. I will create a safety plan with them. I will talk about their past with them. I will be the therapist. And so I think it's important that I just emphasize that that's what a therapist should do. And so they should be giving all that service and all that support. They should be your person basically for that if you don't have anybody else. And the thing I'm trying to do here with Conquering Procrastination is I want to share all these tools and resources with as many people as I can. And I can't possibly be everybody's therapist. So I just want to share on like an information level. This is the way your thoughts are getting in the way. This is the way your emotions can be handled to conquer procrastination. This is the behaviors that will help you get unstuck. So getting into that cycle that I showed you guys and teaching you exactly what tools can get you out of it. So that's my thing with this here. It's more of a consultation. I don't want to say surface level because it can be life-changing, but if you discover that, you're working with your thoughts with us. So like if you're going to be one in the group coming up where we're going to get really into like how do our thoughts play a role. So you have the thought like, I can't do this because I'm worthless. And then I realize I feel that way because my dad hit me. That's not funny. Sorry. So now I'm like laughing at people getting hit. But if you uncover something deeper, as you're doing this work, that's awesome. And I will want to make sure that you have someone locally that you can work that out with if that's what you feel like you want to do right now. And if you want to just stay in the present moment, focusing on how to get unstuck today, then the group's going to be great for you. But if you feel the need to stop and go deeper or backwards, that's what a therapist is for. So I'm kind of going over what I can and can't do. So what I can't do is I can't be your emergency person or your person that goes like deep into your history or your mind and helps you untangle all that, unless you live in BC, Canada, and find me as a therapist separately. I'm not allowed. I'm just not allowed to do that. What I can do is I can help you with the thoughts, the feelings, the behaviors, and the physical side and the situation in terms of changing, like what behavior and thoughts can we change and reverse that cycle of procrastination, stop it, reverse it via tools. So anyways, I hope that's clear. I just want to make sure that if anybody has any questions at all, you know that I'm available via email, Nicole at conqueringprocrastination.ca. Also on Facebook, in our Facebook group, Students Conquering Procrastination, and also on YouTube. So ask any questions. I want this to be super clear, and I hope it's helpful. So feedback is good. Just, any feedback is great, unless you just don't like my office or my hair. I don't really want to hear about that because that would be not helpful. Anyways, so thank you guys, and we'll talk to you soon. Bye.